Recently, one of my rheumatoid arthritis patient came for the follow-up, and she was on 102 kgs when she met me and diagnosed with rheumatoid arthritis. That time we have done a HbA1c test, and so she has been diagnosed as a pre-diabetic state. And that moment she got a doubt that what is the HbA1c or how to diagnose our sugar levels. So to just educate about this condition or diabetes, what investigations will have to be done, let us know in this video. Namaste, I am Dr. Purohithi, Interventional Pain Specialist. HbA1c, it stands for hemoglobin A1c, or also we can call as a glycated hemoglobin. It is a blood test that shows the average blood sugar levels over the past 2 to 3 months in our body. And how does this HbA1c work? Sugar in our body, it gets coated to the protein called hemoglobin in our red blood cells. More sugar in our body, more hemoglobin gets coated with sugar. HbA1c test measures how much of your hemoglobin is glycated or coated with the sugar. So what we have to consider are based on the results, if HbA1c is below 5.7% is considered as a normal, 5.7 to 6.7 considered as a pre-diabetic state. This range have a risk of developing sugar in the future if left untreated or neglected. 6.5% are above considered as a diabetes. There are multiple advantages of doing this HbA1c test. No need of fasting, and it reflects blood sugar levels over the past 2 to 3 months, and it is very useful in monitoring diabetes control. The test is especially helpful for diabetics to know whether their treatment is working or not, whether we are responding to our diabetes treatment or not, and it should be done every 3 months in a diabetic patients. Next blood sugar test is fasting blood sugar or FBS, and we need to give a sample after 8 hours of fasting or overnight fasting. In fasting blood sugar, normal range used to be 70 to 99 milligrams. Pre-diabetes status considered when our fasting blood sugar values are 100 to 125 milligrams. Considered as a diabetic if values rises more than 126. It has a purpose of screening for diabetes or pre-diabetic status. And next investigation is postprandial blood sugar. So if we do this PPBS checkup, it has to be done after 2 hours of meal. Normal range is less than 140, and if diabetes is there, the values rises to more than 200, and it shows how our body handlings our glucose from the food. There is one more investigation called random blood sugar or RBS. For RBS investigation, we can give a blood sample at any time or irrelevant of the food intake. So RBS normal range is less than 140. Symptoms present in diabetes patients rises to more than 200. Purpose of this quick test is to measure our sugar levels. Thank you for watching.